Hello everybody, this is episode 7, Atonic Seizures. This is another generalized seizure group, and yeah, let's get to it. So we'll be starting off with background information, then causes, then symptoms, and avoidance and answer, and then we'll end it off with key takeaway. Imagine you're holding a marionette puppet, and someone suddenly cuts all the strings at once. No warnings, no slow fade, just collapse. That is an atonic seizure. Atonic seizures are sometimes called drop seizures because they cause a sudden, complete loss of muscle tone. The brain basically sends a stand down signal to the muscles and gravity immediately wins. These are generalized seizures, meaning they involve both sides of the brain at the same time. Consciousness may be briefly impaired or lost, but the defining feature isn't convulsions, it's sudden weakness. Unlike dramatic seizures you see in the movies, atonic seizures are quiet, fast, and dangerous, not because of what the brain is doing, but because of how suddenly the body goes limp. Next, we have causes, and we'll also go over the triggers. So atonic seizures are most commonly seen in people with severe epilepsy syndromes, especially the Lennox-Gastaut syndrome, which often begins in early childhood. They're also linked to brain malformations, genetic conditions, and widespread brain injury. These seizures happen because the brain regions responsible for maintaining muscle tone suddenly stops communicating properly. Instead of muscles tightening like they should to keep you upright, they just switch off. Triggers can include fatigue, illness, missed medications, or sensory overload. In many cases, though, atonic seizures seem to come out of nowhere, which makes them especially challenging to manage. So now for symptoms. An atonic seizure usually lasts only a few seconds, but that's all it takes. The head may suddenly drop forward, knees buckle, or the entire body collapses straight to the ground. There's usually no warning, no aura, no time to embrace. 1 second the person is standing, the next second they're on the floor. Think of it like a phone losing signal mid-call. Everything just cuts out. Because the seizure is so brief, people often recover quickly, but injuries are extremely common. Facial injuries, dental trauma, and concussions are a major risk, especially if the person falls forward. Awareness afterward can range from normal to briefly confused. Many people feel embarrassed or frustrated, not because the seizure hurt, but because it happened so suddenly and publicly. And now for avoidance and answer. And the key takeaway. Preventing atonic seizures can be difficult, but treatment usually involves combinations of anti-seizure medications. In some cases, special diets, nerve stimulation devices, or even surgery may be recommended, but these solutions are actually you need doctors or neurologist approval for those. Because these seizures cause sudden falls, safety planning is critical. Many people, especially children, wear protective helmets to prevent head injuries. That's not extreme, it's actually really smart to wear these helmets to prevent head injuries because this seizure is one of the most dangerous type of seizures there are. If you see someone having an atonic seizure, your main job is to not just stop them or try to do anything about the seizure, but it's to do something about the causes of about the aftermath of the seizure. So your main job is to check for injuries. The seizure itself will likely be over by the time you react. Help them up if needed. Stay calm and offer reassurance. Make sure you do not panic. If falls are frequent, unpredictable, or severe, medical evaluation is essential. Repeated atonic seizures aren't just inconvenient, they can be life altering without proper protection. Atonic seizures may be silent and short, but they're one of the most physically dangerous seizure types. Understanding them isn't just about awareness, it's about prevention, protection, and dignity. That's it for episode 7. This is one of the shorter episodes there are, but that's the end. Make sure to check out our Seizure Care app. The Seizure Care app, it can really help you with its medication manager, with its seizure tracker. It's just very gold. It just appears gold to the doctor and the neurologist because they can just see what's going on, how often it's the seizures occurring, if you're actually following the medication. They can really pinpoint the causes, triggers, and they can really help you out with the medication, what type of medication, what type of treatment you should have, and just use the app. It's super good and beneficial for the person experiencing the seizure and the person's family, maybe friends of the person experiencing the seizure. Thank you and have a nice day. That's it for episode 7.